Good afternoon. And today we have an honor to interview Dr. Katherine and Wallace. Good afternoon, Katherine.
Good afternoon. Thank you so much for having me with you today.
Yes, I want to, first of all, thank you to our audience, and if you have trouble sleeping or sleep next to the snoring partner, so this interview is for you. We're going to offer you overlook on a different approach to treatment of snoring and sleep apnea. And if you're a medical professional, I think this interview you find really interesting because we're going to talk about integrative approach. I really like the statement Dr. Katherine have on her website. What just like me, she's trying to build bridges to close the gap between medicine and dentistry. And I think that's we're suffering from lack of it right now. Mm-hmm. So if you're a medical professional, please use our channel as a networking ground. I'm going to put information about Aviara Centers and Aviara Institute on the bottom under the interview, and you can connect with the doctor and see what she does. She has a beautiful website. I personally learned a lot from that approach. And now I'm going to tell you my story about Dr. Ann Wallace. I heard it came to me through the universe. I heard about Aviara Institute and Aviara Centers, actually through some specialists who practice in Aviara Center. Some of them we interview on our channel, like Dr. Kachuk or Mark Nidzievsky or Dr. Zagi's wife, or we're going to have Dr. Roger Price. So, and Dr. Belfor was on our channel. So we kind of practice, not too far philosophically. But then I was really amazed how well organized this system is. And, bravo to you, doctor. And now I'm going to tell you a little bit about you, and we start exploring further. So Dr. Wallace, she graduated from pediatric residency, and then she started a long exploration. And she graduated from a lot of really respectful dental institutions and got her knowledge in reconstructive dentistry, sleep, TMJ, and orthodontic therapy. So she has a lot of knowledge. And the issue of underdeveloped jaw, faces, compromised airway, I guess, was really interesting to you and lead you to create what you create, that integrative approach, because I really find it's really narrow vision when patient come for oral appliance, dentist provide oral appliance, and then goodbye. Because usually these patients have a cascade of different issues, and sometimes they don't even have a sleep apnea, they come for ortho. And that's the role of the broad knowledge, to educate patient or parent what can happen in the future. I think that's a whole art and science of our field. So you did all of it, and you create, you lead a lot of organization, and I think through Aviara Institute, a lot of dentists or other providers who we have as an audience on our channel, like myofunctional therapists, chiropractors, PT, physical therapists, they can see, future and learn. So my first question to you, please tell me about that journey, how it happened from being a pediatric dentist by training, you did whole line of other accomplishments to come to the Aviara Centers and Aviara Institute.
Okay. Thank you for that question. I started out as a pediatric dentist because I just wanted to learn more, because my 2-week rotation in pediatric and dental school was not enough. And I love children and treating children, so I wanted to give them my best. But at the same time, I loved cosmetic and art. I'm very artistic, so I wanted to be able to do everything that dentistry has to offer. And so that's the reason why I practiced as a pediatric dentist for a few years, but then I also went to learn about cosmetic dentistry, neuromuscular dentistry. And, before we can build and make things look pretty, we have to have a good foundation. And that's the reason why I started studying about the TMJ, jaw, joint. Eventually, about 20 years later, it led me to the discovery of airway. and how the airway is the most important aspect of who we are, why we stand the way we do, why we breathe the way we do. And so once I realized that about 10 years ago, I began to develop a concept of, I realized, we really need to work together with medical professionals. So I created the concept of Center for Sleep and Wellness. And eventually that led to Aviara, where medical and dental professionals and even physical medicine, like chiropractors and physical therapists, can work with us to help our patients truly get the whole body wellness, because our body, every parts of our body is connected, and we can't treat just a little piece of it at a time. Our patients are not going to get better. So this is the reason.
I love how you put it. I'm sorry to interrupt you.
No.
I always get that example of, vision of a headless horseman. So we treat just this, and the rest, whatever. And I really like, going back to next question, I want you to tell me, what's the 3 pillars of wellness for you, and how you incorporate those concepts in your everyday practice, or I would say in your philosophy, in your vision, into your centers.
Okay. So for me, the 3 main areas of pillars of wellness is airway, lifestyle, and environment. Because we talk about lifestyle a lot as a pillars of wellness, but we kind of forgot about the airway, or we just didn't know until more recent advancements in research, which showed us how important our airway is, how important our breathing is to our wellness and our overall health. Because if we are not breathing well, then we're not going to sleep well. And if we're not sleeping well, our body is going to go into a sympathetic fight or flight mode, and our body is going to become inflamed. And if our body is inflamed through airway compromise and lifestyle compromise, because we're not eating well, we're not exercising, and our environment is stressful, then we've got 3 areas where our body can get attacked. And this attack leads to inflammation, and almost all chronic diseases come from inflammation. So it's really important that we address all 3 pillars for our patients to be truly healthy.
I would like to ask you a little bit more specific. How you elaborate, how specialists in Aviara centers collaborate to address those 3 pillars of health?
Okay, so when the patients come to us, we have actually, our integrative approach is in 3 levels of care. So the level 1 care actually involves a airway TMD dentist like myself. So we become the navigator of level 1 care. And we're able to take the patient, take a comprehensive approach to their health history, their injury history, surgery history, all of the things that the patient has gone through in their life can impact their health. So we want to know everything, so we're not missing anything. We really want to know what the root cause is. We don't want to give them treatment that is not appropriate for them. So that's why I become the navigating dentist, and then I do a head and neck exam, and then I bring in we have an oral facial myofunctional therapist who can look at the dysfunction or function of their oral facial muscles, especially the tongue. And then we have a SOT chiropractor who understands the alignment of the body, the sacrum to the occiput. Our pelvis alignment affects our temporal bone alignment and vice versa. So there's so many things that are connected through fascial system, the neurological system, that if we don't work together, we can't help our patients get better. So we do address the airway at level 1 care with the 3 main team members. And then we do address lifestyle as far as, looking at their history. We look at what their lifestyle is like. We make some standard basic recommendation on things that can help most people. So level 1 care will help at least 80% of the patients that are coming into our office with whatever problems that they may be having. But then if they are more complex, then we can start to incorporate level 2. And the level 2, we have specialists that do specific analysis, like Dr. Bahar, who can analyze the cranial strain and the cranial bones. And then Mikhail Nizilsky, who is a functional physical therapist, who can really understand the posture and how that affects the patient's overall health. And then we have a functional medicine doctor who can do consultations on their lifestyle a little bit more in depth to identify and maybe do some further testing to see what that patient needs. So we have a 3-tiered approach. That way the patients, since most patients will get better under tier or level 1 care, we want to start everyone there. We don't want to overwhelm them with too many things and too many specialists. I made the mistake of doing that in the beginning. I wanted everyone to have all the answers in the beginning, and it was a little bit too much for everyone. And so this is why after about 2 years, we've developed this system where it's more organized and systematic, that is palatable for all of us, including the patients.
Yeah, no, that's great. I really like how, it goes by levels, because,
Yes.
if somebody gets, problems addressed, that's wonderful. But I would like to ask you that question. How does compromised airway contribute to breathing and sleep disorders? And what specific strategy you use to address those issues? And thank you very much for saying what, we, so connected. So that's kind of a continuation of that question.
Okay, sure. So oxygen, obviously, we know is the currency of life. It is the most important thing. Our body will do anything it can get to get oxygen to the brain, especially because we can't live, our brain will start to die after about 4 minutes. And so how we breathe is really important, but how do we identify it? If we look at somebody with their mouth hanging open, they're breathing through their mouth, or breathing very fast, or some breathing dysfunctions are very obvious and we know what we need to do. But a lot of them are more subtle. A lot of people are breathing dysfunctionally and it's affecting their sleep and their quality of life. And it's taking them into a very fight or flight mode where it's inflaming their system, but they don't even know that. And so those are the ones that we actually do, simple tests like nasal function test, like rhinometer to actually look at the airflow. But, we can see a lot just on a CBCT. So we look at a 3D CT that actually shows us what their airway looks like. So we start with the size. We look at what's obstructing it. Is their tongue obstructing their airway? Is their nose, the turbinates, is it swollen? Do they have deviated septum? So there's a lot of things we can see on the CT, but we also have a technology called capnometer. So this is one of our newest technology, and I love it because we can actually see in real time all of these kind of in-between patients, maybe the mild to moderate patients that don't know that they have breathing dysfunction. We're able to utilize this technology to actually see, so the patients can see how their posture and how they breathe actually affects their CO2 level. And it's the CO2 that is actually the gatekeeper of oxygen. Without the right level of CO2, your brain and your cells are not going to get the oxygen it needs. So it's really important to understand that. And we can actually train, slow down our breathing to actually bring that CO2 level up to the optimal position. And so patients can actually see that they actually can control their nervous system and their overall health.
But the question, what I want continuation of that question.
Okay.
I know you had experience treating kids, and my heart is, bleeding for kids. Why kids, not only kids, but kids and adults have so many allergies right now? And, that's question related to the breathing because, asthma. I look at the medical history, asthma, next patient, asthma. I'm from Soviet Union. We can criticize all day long, but I didn't know anyone with asthma. I didn't know anyone with, maybe I knew one person with allergy. Now, maybe I know one person without allergy. So why?
Yes. So I think a lot of people think when they have allergies and asthma, they think that they're just genetically prone to have those allergies and asthma because their parents had it or their grandparents had it. But what we're finding out is that actually we can actually reduce, even if they had a propensity for it, by what we do and what we eat and how we breathe. These are all things that can actually control their allergies and their asthma, because how we breathe and what we eat and the things in the toxic environment, all of those things, and mouth breathing, will actually cause our body to go into a sympathetic state, which is what causes our body to have inflammation. So when we have inflammation already as a baseline, what we eat is going to trigger that, even little exercise. And because our cup is already full, and just one last drop is going to tip them over to have severe allergy symptoms and asthmatic symptoms. But what the good news is, a lot of that can be managed and improved and reversed by our lifestyle and improving our airway and our environment.
And, kind of continuation also constantly puzzle me. Of course, I have a busy practice with a lot of sleep apnea patients, and I can say, oh my God, those patients put the bread on my table, but this is wrong. This is wrong. I'm wondering why, in your opinion, so many people now have sleep and breathing issues. So many people snore. Why sleep apnea is such an epidemic right now? What happened?
Yes, I think it's because our lifestyle is a lot more toxic to our body than it used to be. Our environment, obviously, our air pollution, all of that is worse as well. But the food that we're eating has such a big impact on our nervous system and how our body functions. And so for example, for kids, they're going to have sleep apnea if their tonsils are swollen, their adenoids are swollen. And why are they swollen? Because they're mouth breathing. Well, why are they mouth breathing? Because they can't breathe through their nose. And why can't they breathe through their nose? It's because their lifestyle is actually causing a lot of inflammation in their system. So it's not genetic. At least most of the time it's not. It is actually what we eat and how we behave and how we breathe that actually affects our sleep, as well as our chronic inflammation and our overall health.
Yes, I really hope with your integrative approach, we can reduce that. And also,
Yes.
Talking about kids, you have so much experience with pediatric dentistry. And I asked that question to a lot of specialists. Why so many kids need braces now?
Yes. Okay. I think that kind of goes back to the same problem with breathing and airway and lifestyle. Because if our tonsils are swollen, if our nose turbinates are swollen and our sinus is congested, we can't breathe. We're going to breathe through our mouth. And then when we breathe through our mouth, our jaw and our tongue will not be in the correct position to develop our jaw. It's going to drop back and block the airway. They're not going to be able to sleep. Their jaw and their faces are not going to develop properly. If their upper jaw is not developing, guess what? The lower jaw is not going to have room to come forward. And then if it can't come forward, the lower jaw, which I call the car, is going to get dented in the front. And that's what crooked teeth is. It's denting, because lower jaw is like, hey, I want to be here to breathe, but there's no room. It's stuck because the upper jaw and the upper teeth are in the way. And so it's so crucial how we position our tongue and how we breathe so that our face and our jaw and everything can develop. And that, I believe that is the reason why we have crooked teeth and we need braces. So if we can, from the very beginning, if we can identify like tight frenum, lingual frenum, things that prevent the development of our jaw, or any kind of allergies, or food and diet, and identify things that are causing our body to be inflamed, then we can support our children's growth and development and their health. So they won't need braces.
Yes. No, I think it's such a great answer. And, my philosophy is exactly the same. And I really appreciate what working with that, and I'm working with that. And I really hope we can educate public, we can educate our patients, we can educate medical providers around us. And I think what you're doing, actually bringing medical providers into your practice and showing what this, model can work and can make people healthier. I think that's amazing thing. And I really appreciate, you and what you find the time to come and speak about that on our channel. And I really hope your example going to be leading example to a lot of other practitioners. So thank you very much.
Thank you. Thank you so much for having me.